All right. Thank you, everybody, for joining us today. Today, we are talking about how to choose a facility, a long-term care facility, and the admission process. My name is Ann Humphreys, and I'm one of the long-term care ombudsmen here at MAG, and we're glad that you can join us. So, we're going to start off with a question. How do you feel about choosing a long term care facility for yourself or your loved one? And because we're recording this, we're not going to just think about this question and the answers we won't be participating out loud. So, and then here are some comments and feelings and thoughts that we have heard over the years, and you might identify with some of them or all of them. It is a big decision when you're trying to choose a facility. There's a lot that goes into it. A lot of times, it's the first time people have ever done anything like this. And so there's a lot of unknowns. And hopefully, with the information we can provide today, it will be helpful and kind of alleviate a little bit of that stress and that worry. So, all right, we're going to talk about three different areas. Excuse me while I get a drink. Sorry about that. We're going to talk about three different areas: how to choose a facility, how to pay for a facility, and then how to admit to a facility. So let's start with how to choose a facility. So if you are looking for a facility, and a lot of times people don't know a lot about this industry, so they don't know the differences between assisted living or skilled nursing facilities or independent living. There's a lot of terminologies out there. And so if that's where you're at and you want to just get more information, we did do a senior education video a few months ago that went into those different levels more in depth. And so you can either watch the video or review the slides. And my slides will be sent out afterwards so that you'll have access to all these resources. So that is an option for you to go back and look at that information. If you are looking for facilities in Utah Summit or Wasatch County, we do have online a map that is color coded by the type of facility and what they provide. Or we have in our senior help guide, there are listings for assisted living facilities and skilled nursing facilities. If you are looking for resources beyond assisted living and skilled nursing facilities or outside our three-county area, the Utah Senior Blue Book is an option. It's a pretty small book. You can often find it at a grocery store or at a skilled nursing facility, or you can look it up online, and they have a lot of good information. There's also the National Elder Care Locator that you put in your city or your county or your zip code, and it can give you a lot of different options, not just assisted living and skilled nursing facilities. If you're working with the New Choice Waiver Program, the case managers are a great resource. They know the assisted living facilities in the area that work with the New Choice Waiver Program and also know the income and rent and requirements for the different facilities. And then some families will work with a case management or a placement agency. Some of them are listed in the MAG Senior Help Guide. And so these are professionals that will help either setting up home services or help you find and place a loved one in a facility. Sometimes they can be a resource in terms of Medicaid or the veterans. They have their own payment structure. Sometimes you have to pay for the services they provide, or they may be commission based. So ask them where the money comes from to pay for those services. So those are some ideas of where to just find a list of facilities to start with. Another one, this top one, the assisted living facilities. So this is the agency within the state government that does the surveys and licensing for the different facilities. And I'll show you this in just a minute, but you can type in there the county or city or zip code and get a list of the facilities you're looking for. So just to let you know, the assisted living facilities, they are licensed by the state, but there is no rating system. It will say on their listing, and again, I'll show you this in a minute, conditional license. And so that's how you would know that there's a facility that's having more than the normal amount of problems, and it's kind of on a probationary period with the state. For ratings for skilled nursing facilities, the federal government, with the Medicare site, has a really good website, and I'll show you an example of this in a minute. It is also a place where you can type in your location, again, city, zip code, and it will give you a list of facilities. And they do have a rating system. They rate on several different areas, and even within those areas, they will break it down, and they have really good explanations of what they use or what they base those ratings on. I will say that whenever you're looking at the assisted living facility site or the skilled nursing facility site, these are retroactive. They're looking backwards at what has gone on. And because the surveys come up every year or every few years, the information there may be 1 to 3 years in the past. And it is a good benchmark. It's a good starting place, but also know that sometimes things change, and what they're rating or what their surveys were like a few years ago may be very different than what type of care they're providing now. As long-term care ombudsman, we can also give information about the facilities. We can't refer or recommend, but we do go into facilities at least quarterly and give you publicly available information. So for instance, we can say, well, that facility has had several administrators in the last couple of years. There seems to be a lot of turnover. Or maybe we can say their surveys have actually been pretty good over the last few years that we've seen. And then always word of mouth is a great referral for any type of service, including this one. So talking with friends or neighbors that have been in facilities, and then any home health or hospice agencies, they go into a lot of facilities and can give you some insight. So this is the example that I was telling you about, this assisted living facilities website. So this top part is what you'll see first. And if you're just looking for a specific name, you can do the name. If you're looking for, what facilities are in my area, you can put in the county. You do need to put in the provider type. It will have several different options. And they do the licensing for lots of different healthcare entities. So birthing centers, assisted living facilities, urgent care facilities. And so if you go ahead and click the specific provider types, then you won't get overwhelmed. And then the light blue section, this is an example if I had typed in a specific facility name, what it would look like. And I did black it out, but it would have the name of the facility, the contact information, the address, how many beds are in the facility, the area where it says secure beds, that would be if it's a memory care unit. So it might have 100 beds and 30 of those beds are a specific memory care or secured unit. And then this example, it does have in red that sanctioned license. And so you know that that's a facility that's on probation. I will say this facility is no longer on probation. They were able to make enough changes that the state licensing agency said, okay, you're off that sanction period, and now you can keep moving. When a facility is on a sanctioned license, sometimes they receive fines, or sometimes they can't admit new residents. There's different things that the licensing agency can do. So this is the example of that skilled nursing facility website. And so when you first go to it, what's on the left, it will show up. And so you can choose your location, and it will give you a list of facilities and a map that shows where they are. And then on the right gives you some ideas about what their rating system is. And like it says, learn how Medicare calculates this rating. If you click on view staffing information, as it shows below, There's several different aspects that they look at in terms of staffing. And so it's a really good and well organized website that gives a lot of good information. So those are some ideas of how to find the facilities, how to look at them in terms of rating or quality. And then hopefully you'll have the time and the luxury of being able to go to a facility. We know that that sometimes doesn't always happen, but if you can go to a facility, that can be a really good way of really understanding what it's like and assessing whether it's the right fit for you or your loved one. The top bullet point, that is a list that's put out by a national organization of questions to ask when you visit a nursing home. And it's a very lengthy list. And so I kind of summarized some of the things that are on that list and then things that we look for or would find important as ombudsmen. So your first thing is to really just use your senses. Is the facility overall, is it clean? How are the smells? Are the sounds appropriate? Not too noisy, but there can be certain noise if they're playing bingo or they have a musical performance or something like that. And then also, what are you observing in terms of the staff? What is their demeanor like? How are they interacting with you or other staff members or residents? Does that feel good and friendly? You can ask about staff. So ratios would be if the facility has a certain number of residents, then they would need to have a certain number of staff members for that resident. So just to let you know, there are no regulations either for assisted living facilities or skilled nursing facilities that say have a hard and fast rule that there's a certain number of staff required for a certain number of residents. But you can ask the facility, what is your general staffing ratio? What's your turnover like? If it's a weekend or an evening, are there managers available, or what happens if there's an emergency? There is a link to a handout here that talks about skilled nursing facilities. So even though they are not required to have a certain number with that ratio, they are required to post every day in a public area the number of residents in the facility and the staff that they have on hand. So this handout does give more information or details about that. And I would say definitely whenever you're touring a facility, ask them what about the staff. Food is important, and so if possible, either observe or ask to join for a meal and see what it's like. Always ask about special diets, whether it's diabetic or gluten-free or something like that. And then every facility should have a plan in place if a person doesn't like a meal and they need an alternate. So always ask about that. If somebody's not going to like a meal, do they have to let you know ahead of time, or can they request something at the moment? Now, those alternates may be something like a sandwich or a side salad or something that's easily prepared, but it's a good thing to ask what that setup is like. All of the facilities are required to post their activity calendar, and whether or not you or your loved one would be interested in the activities, I find as an ombudsman, it's kind of a good barometer of a facility. If they have an activity calendar and there's an activity posted for 3:00 and I'm there at 3:00, if it's happening, that's a good sign that things are doing well in that facility. You can also ask about outings like going to the park or having a trip to watch the fall leaves. Many facilities also have shopping trips on a regular basis, and then resident or family councils. And then as you're in the facility, just observe the other residents. Are they dressed and groomed, their hair combed, dressed in good clothing? You can ask to speak with a resident. Odds are they're probably going to have you speak with a resident that's generally happy and doesn't have a lot of concerns. So you have to just know that their source is going to be biased on their side. But it definitely is worth asking to talk with somebody. I will say that sometimes you'll see many of the residents well-dressed and groomed, and then you might see one or two that are not. Individuals have a choice on how their dressing and grooming is supposed to be. And especially when somebody has dementia, doing things like combing their hair or having somebody help brush their teeth, that may be really difficult for somebody with dementia. It may be very upsetting to them. And so staff may prioritize helping them with the toileting needs or some of those higher and more important needs. And so if you see a couple people that are, maybe a little bit more disheveled, realize that that is more about that resident than about the facility in general. And then I would encourage you to ask about the medical services. Do they have visiting medical staff like physician's assistants or nurse practitioners? What hospice companies do they work with? Do they provide transportation for medical appointments, and how do you set that up? And then who is their contracted pharmacy? Can you use your own pharmacy? Some of those details that may be specific to your situation. And then always bring up any kind of unique situations. If your loved one smokes, what is their smoking policy? If your loved one doesn't speak English, or maybe English was their second language, what accommodations do they make? If possible, it helps to have 2 or more people visiting, and then have one person kind of the designated note taker, and they can have the list of important questions that you want to make sure that you ask. And so they can not only make notes, but also, oh yeah, we haven't asked about A or B or C. And then if you're visiting more than one facility, between visits, we encourage you to stop, make some notes, talk about it, have some impressions, because after a while they'll start to blend together. If at all possible, we encourage residents or future residents to be involved in the decision, whether that's going on tours. Maybe they want to go on all 10 tours. Maybe they're only up to going on 2, or maybe even just 1. If at all possible, help them to be able to see the facility beforehand. If they can't tour in person, then many of the facilities will have pictures, websites, or virtual tours on their websites. And you may talk about the discussion about your experiences. We went to A, B, and C. We like this about A. We like this about C. We didn't like anything about the other ones. And let them know kind of your thought process and what things you were looking at as you make the decision, and include them as much as possible. I would say, as you're going into facilities, think about your loved one and what their priorities are, either recently or throughout their life. And let me give you a couple examples. So let's say there is a woman that has always been the party queen. If there was a party or a gathering and they love to host them, or they attended, whether it's a city gathering or a church gathering or a neighborhood bunco group, they were just the life of the party. But recently, they've not been able to drive, they haven't been able to navigate stairs and some of those things, and so they haven't been attending, and that's really important to them. So for that person, going to a facility that has a robust activity program may be really important. But let's say kind of the same scenario, somebody was always the party person, but now they're having a lot of pain because of their medical condition. They're really tired a lot and just are not up to being involved in a lot of activities. And so they may want to preserve their time and energy, maybe for therapy or maybe for when the family visits. And so at this point in their life, even though activities have always been important, right now it is not as high as a priority as it was in the past. So think about your loved one, talk to them about what things they are interested in right now. And then there's something called the chandelier effect. Many facilities will look great, either they're new facilities or they've been recently remodeled or redecorated, and they look wonderful. That Sometimes the care is great in those facilities, but just because it looks great does not mean the care is going to be the same standard that you want. And then the last point is no matter how much time and energy and thought you put into this, things may change. We see a lot of residents that will be in assisted living, and then they go to the hospital, and then they go to rehab, and then they come back to the assisted living. Or they're in the assisted living and their care needs change and they have to go back to a skilled nursing facility. And so the residents' needs may change, and it may be that they need to go to a different type of facility or a different facility. Also recognize that facilities change. Sometimes facilities can be really good, and then either slowly or quite suddenly things change within the facility. And we as ombudsmen can help advocate and for things to change back and improve. But ultimately, sometimes it may be to the point that you decide the quality is really decreased and we need to make a change. So there's lots of different reasons that things can go up or down, but realize that sometimes change will happen. And that's not a reflection on how well you did in making the choice about a facility. All right, one of the big things that is really important is how to pay for a facility. And the cost for these facilities is really high. And so that's often a big question for people. So, some general notes about the finances. In skilled nursing facilities, they charge by the day. Assisted living facilities are more like an apartment, so the charges are by the month. And they have in assisted livings, they have a wide variety of how those payment structures are created. So you may have like different levels that you have to pay, or you may have a base rate with a la carte services added on. And so when you're touring these places or investigating them, always ask what's included in the rates, why it may change, and just understand what the payment structure is like. The contracts that you review, the contracts that you sign, we encourage you to review those before signing. And then in terms of the finances, if you are like an adult child or a non-spouse family member, a guardian or power of attorney, you are responsible to use the resident's money to pay for the stay, not necessarily your own. So for instance, if my mother was in a facility, I would be responsible to make sure that her funds were used, but I wouldn't have to use my personal funds. Now, it is different if it's a spouse. So if my husband were to go into a facility, we are community property state, so our finances are already bundled together. And then some options to make things easier in terms of making sure you keep up on the payments are Social Security, Rep Payee, automatic bill pay, that kind of thing. So we're going to talk for a few minutes about Medicare and other insurances. So this would be like an employer type of health insurance. And these come into effect only for nursing homes or skilled nursing facilities. And it's short-term only. And Medicare, their maximum covered period is 100 days. Other insurance, like my work insurance, my work health insurance, it has a maximum of 60 days. And know that the insurance companies love them, but their goal is to decrease their costs as much as possible. So a lot of times you will not reach that maximum number of days. And then if somebody has a Medicare Advantage plan or like another insurance, like an employer type of insurance, you may see one title, United Healthcare or Cigna or something like that. But within those umbrellas, they have lots of different plans. And the contracts that they have with facilities may be specific to Plan A or Plan B or whatever they name their different plans. And when you talk with the customer service rep to see which plan or facilities are covered under your plan, they may or may not have access to all of that information. So a good rule of thumb is to just double check with the facility, and they will look up with your Medicare Advantage plan contact information, your identification number that they have a contract that would work with that plan. Hopefully, the hospital discharge planner and the facility would have already made that screening process and only giving you facilities that would work with your plan. But that's just kind of a good rule of thumb. This is a good website from the federal government. It does talk about Medicare coverage in skilled nursing facilities, what kinds of things it pays for, how that coverage works. And then just to let you know, when that coverage ends, you will receive what's called a notice of Medicare non-coverage. They have to give you that a certain number of days ahead of time. And many people are concerned that it's ending too soon, and so we do encourage people to appeal. Many people win that appeal, and then you'll get covered for another week or two. You'll get an extension, and then you'll get another notice, and you can appeal that one. And so we've seen people receive 3 or more of those notices and appeal and win, 2, 3, 4 times. But eventually that coverage will end. It's not indefinite. Now we're going to talk about Medicaid. And so this is the state and federal program for individuals who have a financial need for care. And there's some general information in this link right at the top. So for Medicaid to pay for individuals in long-term care, whether that's assisted living or skilled nursing facility, there are 2 types of criteria they need to make. One of them is that they need to meet a level of care requirement, and sometimes you'll hear the term 10A. So several things come into play here, but essentially they need substantial assistance with activities of daily living. So activities of daily living include what's happening with their body. So help dressing, help moving from a bed to a wheelchair, from a wheelchair to the toilet, help with toileting needs. It does not include things like being able to make food for themselves or grocery shopping or any kind of cleaning, housework type of things. So they need to meet a certain amount of level of care requirements. The other eligibility requirements are related to income and assets. And for a single person, their assets need to be below $2,000. So this would include savings account, bank accounts, retirement accounts, those types of things. Married couples where one of the people is living in the community and one will be in long-term care, they have special income and asset limits, and those can be complicated. Sometimes people work with a certified Medicaid planner to make sure that they are able to go through that process and get the benefits if they are eligible. So to get onto Medicaid, the application goes through the Department of Workforce Services. You can use a certified Medicaid planner. Some facility staff or a facility will have a contract with somebody that can help with that Medicaid process. That can be really helpful, or you can certainly apply on your own. I did put a link in here for the New Choice Waiver Program. This is specific for assisted living facilities, and I'm not going to go into any details about that today. This is a good handout, and I can ask questions maybe after the recording or individually if you have questions. And then just know that as part of the application process for Medicaid, they will request documentation back several years, and I've listed some of the things that they will look at. And so maybe you're not eligible today, the assets aren't within those limits today, but they might be in the future. So these are things to start thinking about and preparing and organizing. They will look backwards and make sure that the funds that a person had have been used for that person appropriately. And if not, then sanction periods are possible. So to give you some examples, let's say a man sells his house maybe for half price to one of his family members because he's generous, and then the money from the house he gives to another family member. So if that's done within their look back period, that would be a problem, and and a person would not be eligible for a certain amount of time because they didn't use their assets and income appropriately for themselves. And then liens can be placed on hold or can be placed on homes, so just be aware of that. Medicaid is a pretty complicated system. There are a lot of people that know a lot more than I do about Medicaid, so there are answers out there, but it is a great service because the cost of care is so high. We'll talk briefly about other ways that people pay for long-term care. If somebody is paying privately for both assisted living and skilled nursing facilities, they generally require a 30-day advance payment upfront. Depending on the contract, well, for skilled nursing facility, if they leave before those 30 days, then they're required to give them a refund unless there's a bed hold. For assisted living facilities, in the contract, it will give times that that money can be, like prorated and refunded. It really depends on the contract and how it's written. If somebody is a veteran, there are different programs, and the VA decides the eligibility for the different programs. And then sometimes, depending on the program that they're eligible for, they may be limited to a facility that has a contract with the VA. So working directly with the VA is a good step. And then some people do have long-term care insurance. I would say that if that's a situation where you're in, that is great. Good planning ahead. Look at the contract, look at the insurance policy that you have to make sure you understand what is covered, under what situations it's covered. Always reach out to the insurance company to make sure that you're understanding the policy. And then some insurance companies can be really difficult to work with. So I say just start at the beginning. Make notes of any kind of telephone calls you have, any emails that you have, so that you have a record of your interactions with them. All right, so we've covered how to choose a facility, how to pay for a facility. Let's assume that we've got those two things covered, and now it's time to admit somebody. The people that you're going to work with, every facility and corporation is a little different, but every facility will have somebody identified as kind of the point person to work with admissions. It could be an admissions director for that facility. It could be the administrator at the facility. It could be a corporate person that handles admissions for several facilities within their corporation. And there could be another title or designation within the facility. And their job is to have people come into the building because they want people to take care of. They want customers or residents. And so they are going to be your point person for all of the admission logistics and questions. Part of their role will be not only working with you, but coordinating with hospital discharge planners, hospital discharge planners, hospice home health staff, if you've been working with them, the case managers through New Choice Waiver, or any other entities that you've been working with. And once you've decided on a facility, the process can take several business days. Occasionally, it can happen really quickly if they're coming from the hospital or the emergency room. It can also take a lot longer, especially if you start ahead of time and you're working on that adjustment period and trying to decide whether it's the right time. So even though I say it can take several business days, it can be longer or shorter than that. All of the facilities will require paperwork, and that includes current medical records. If they're coming from the hospital, that's something that they should have in hand pretty quickly. They want to make sure that the residents are going to be free of TB. We definitely don't want to have any issues that way. And then they will need to assess the resident. And a lot of times that includes a nurse or a staff member from the facility going out either to their home or to their hospital or to another facility where they're at, and making sure that they understand what that resident needs and making sure that it's a good match for their facility. So, for instance, um, maybe somebody needs help getting up from a bed and into a wheelchair. For assisted living facilities, if that takes more than one person, then that might not be a good match for that facility because of their regulations. So they do need to do that assessment. If they're coming from a hospital, sometimes that assessment can be done by the phone from one nurse to another, but a lot of times it is in person. They'll also require, and we strongly encourage you to provide to the facility advance directives, so including living wills, guardianships, or powers of attorney. That's the reason why people set those things up ahead of time, is so that they can be used when they're not able to make decisions for themselves anymore. And then any type of insurance information, a lot of times the facilities will use that and need that on their records. A couple notes specifically for skilled nursing facilities. There is what's called a PASAR, which is a screening for individuals with serious mental illness, intellectual disabilities, or developmental disabilities. So people with these issues can be in a skilled nursing facility, but the preference is that they're in community-based settings. So that's what this is for. And then in assisted livings, there need to be some decisions made about medication administration. So kind of the choices are the facility is going to take care of interacting with the pharmacy, calling for refills, and then giving the medication. Or the other option would be families or residents being in charge of the medications. And that needs to be decided beforehand. And then the admission paperwork, a lot of times it can be quite lengthy. And so it is important for it to be signed either before or very soon after admission, because without this paperwork, legally, the staff can't help or treat the resident. And it is a binding contract during the stay. So you can always ask for the paperwork to review it before signing. Certainly ask questions if you don't understand. And then if the resident is at all able to involve them in the process as well. And so the first day or the first few days of admission, what are some things to help make that transition as smooth as possible? Prepare or bringing personal items. So if it's somebody's going into an assisted living, this is going to include bringing in furniture and personal items and really moving them in. If it's somebody that's coming from the hospital to a skilled nursing facility, they're just going to be there for a few weeks for rehab. That might just be bringing in some comfortable clothes and, maybe some books to read or a couple pictures of family to help them feel comfortable in that space. We encourage them to wear some comfortable clothes because a lot of times there will be some evaluations, vital signs, maybe even some therapy evaluations within the first day or so, and so you want them to be comfortable. If they come from the hospital, they may come in just a hospital gown, and that's fine, but a lot of times in the facilities, they'll be wearing more regular type of clothes. And then always double check that the facility has the correct information. So make sure that the telephone numbers for family members are correct, or if you have email addresses, make sure they have the spelling correct. And then medications are really important. Hopefully that list of medications that's coming from the hospital or from the provider is accurate, but you want to double check that. And let me give you a couple of examples. There was a woman that we worked with, and she'd been in a facility for a few months, and she was just really struggling with her mental health. As we did a little bit of investigating, we realized that she had been on an antidepressant when she was living in the community. Then she had a medical event, went to the hospital, came to rehab, then went to an assisted living. And somewhere in that whole process, that antidepressant had been dropped from her list. And so once that was put back on and she had the mental health services that she needed, things got a lot better for her. So double check and compare medications that they were on beforehand. And then I will say about pain medications, a lot of times we'll see individuals that are in the hospital and they've been on a regular every 4 hours, every 6 hours, every 8 hours for pain medications, but when they come to the rehab facility or the nursing home or the assisted living facility, that medication order will change and it will become a as needed or a PRN medication. And the resident may not know that. And so they'll say, they're not giving me my pain medication. But the way the new order is written is the resident has to ask for it, or the family member has to make sure that the resident's needs are known. What we also see is a person will come into a facility and the medications haven't arrived from the pharmacy yet, especially the pain medications. And the pain medication that they had earlier has worn off. And so you can definitely ask the facility, when are those pain medications coming? Usually they will have kind of an emergency supply of medications that they can use with the doctor's order for the correct medication and see if that's available. So really work on those medications to make sure they're correct. Double check the dietary orders, and then if there are follow-up appointments, make sure that those are on this facility's schedule and make sure you know who's going to do the transportation. And then if they're in assisted living, especially if home health or hospice are going to be involved, make sure that those expectations and orders are in place. So every facility should have an inventory that you fill out of items that come into the facility. So complete this for the things that you bring in ahead of time, and then whenever you bring in something new or something from home, or whenever you take something away permanently, make sure that you update that, because if an item is not on the inventory, then the facility has no obligation to reimburse or replace that item. And then it can be really overwhelming in those first few hours or first few days, the number of people, staff members that you meet, the number of new residents that somebody meet. It can be really overwhelming. So just kind of take a deep breath and know that that may be an issue. And then, especially with skilled nursing facilities, within the first days or week, they should have a meeting called a care plan meeting. Assisted living facilities have these as well, but not always quite as soon. You can always ask for a care plan meeting or an IDT meeting, and this is a good opportunity to discuss with dietary, nursing, therapy, any of the different areas, things that are going on, good, bad, just clarifying. If you as a family member can't attend, ask them if they can reschedule it, or ask that if you can be involved by telephone or video. We do a lot of meetings as ombudsmen. We can attend those meetings with the residents' permission, and they can be really helpful to have everybody in the same room on the same plan or on the same page. And then finally, just to let you know what our role is as the long-term care ombudsman, we do visit facilities on a regular basis, and our role is to advocate for residents with their consent. And our focus is on quality of care, quality of life, resident rights, and discharge issues. And a lot of our time, we answer a lot of questions, really from anybody on anything related to long-term care. If we don't know the answer, we will try to find it out or find a resource that can work. As I've said, we can give information about facilities, but we can't refer or recommend. And whenever somebody contacts us, all of those conversations are confidential unless you give us permission or the resident gives us permission to move forward. So we are a great sounding board and we love to work with people. And there's my contact information. And I'm going to stop sharing. That is a lot of information. But also knowing that there are lots of individual questions, and we're happy to answer those either offline or in the time that we have left.
Thank you so much, Anne. That was really, really helpful, very informative. I'll stop our recording now.